So my name is Heidi Parisod and I'm the director of the Finnish JBI Center. And also my background organization is the Nursing Research Foundation, which is a national organization here in Finland. I've been involved about 6 years, first as a researcher at the Nursing Research Foundation, and then for 1 year as the director. What has motivated me maybe the most is that I think there is so much potential in collaboration and working together with JBI and different centers around the world. It helps us to build better evidence for decision making and develop evidence-based healthcare. As a national organization, one main thing that we do is we develop clinical guidelines for nursing. So in that way, the evidence synthesis is in really important position in our organization. But at the same time, if we don't focus also on the implementation side, it's not enough that we only publish clinical guidelines or systematic reviews. We also need these structures and collaboration and how we implement this evidence and these guidelines into practice. We mainly work together remotely, but I think one strength of our center is that we have several national organizations involved, and together we form our center. And in addition to that, we work closely together with several other organizations, and this allows us to utilize different kinds of expertise in achieving our goals. And also when we are discussing together and we share the same message that's directed, for example, at policymakers, we have better chances to get our messages through. So that's one way how we work together. I enjoy being part of the JBIC. I think it's really important that we have both national and international networks, and it is great to be able to work together to achieve these common goals that we have. I think these meetings where you are able to meet people from different organizations and around the world, it's always really nice, because then you get new ideas and that you can take home with you. We use the JBI model of evidence-based healthcare quite a lot, especially when we are talking with clinicians or with policymakers, and we explain them that what steps needs to be taken and what kind of collaboration we need, so that we are able to develop and ensure evidence-based healthcare in Finland. And I think this model, it's really well concretizes these things, and it's really helpful to use that in different kind of presentations and discussions. One of the most rewarding things is to see how the hard work is producing results, and how the better understanding of what evidence and evidence-based healthcare means is spreading more widely. And there is also increasing demand at the moment for evidence-based practices and evidence-based social and healthcare in Finland. And this has also been really pleasant to observe. It has been really nice to see that how we find always new partners who we can collaborate with, both at national and international levels. So I think that's a really nice thing to see.